Myasthenia Gravis, a disease that's hard to say and hard to live with. For short, it's called MG. And here to tell us more is Dr. Tahseen Mozaffar, along with CEO of the MG Foundation of America and patient herself, Nancy Law. Thank you both for being here.
Thank you, Alex.
So, Doctor, starting with you, can you tell us a description of what myasthenia gravis actually is for folks who don't know?
Yes, Alex, thank you for having us on the show. Myasthenia gravis is a rare neurological condition that causes muscle weakness, and the particular feature of this disease is fatigable muscle weakness. So muscles get tired with repeated action. And one good example of that would be the eyelids, which are open at the beginning of a conversation. The eyelids will start drooping and almost shut down on you. Or folks who are eating and no longer able to chew their food, are no longer able to speak their sentences because they get tired. It's a rare disease. We estimate there are about 60,000 individuals with this disease in the US. And it's a disease that can affect any age group. So we've seen patients who are very young in childhood, and we've seen individuals who are 80 years old and have this disease.
Now, does this disease have a gradual onset, or does it all sort of just come at once? What sort of symptoms should people be looking for?
This disease usually has reasonably rapid onset. So they may suddenly develop double vision. They may suddenly develop difficulty with chewing and swallowing, or generalized muscle weakness to the extent that they're no longer able to take care of themselves. So it's a rapid onset within a matter of days, rather than weeks or months. And people will seek medical attention because they're having problems carrying on with activities of daily living.
Right, and Nancy, like I mentioned, you have been living with MG. Would you mind sharing a little bit of your personal story and how it's affected your life?
Sure. I was diagnosed 22 years ago, and I had, I think, pretty much all of the symptoms that Dr. Mozaffar just described. But the really startling one was being at a conference and finding that I was unable to speak. I would begin a sentence. By the end of the sentence, I had no voice. And as other symptoms came on, my ability to do normal day-to-day things was diminished. I had difficulty walking. I had difficulty eating, chewing, swallowing. I had difficulty holding my arms up long enough to wash my hair or use the curling iron. I had finally even difficulty with respiration. So difficulty, because the diaphragm is a muscle too, and it can be affected by MG. Part of that journey then was finding the right healthcare team to help me to manage MG, and also to be sure that I was informed about the disease myself. So I went to myasthenia.org, the MGFA's website. There was information for me there, and I also learned a lot about what I needed to do to be a take-charge patient. Because when you have a rare disease, you have to find a doctor who's knowledgeable and also willing to work with you, because all treatments don't work for every patient with MG. It's a journey to find the right treatment regimen.
Right, I think that's extremely valuable advice really for any disease, for anybody, to be a take-charge patient and take control of your situation. There's two sides to it. There's you, and then there's those healthcare professionals that you're working with. So before I let you both go, where can people actually log on to and get more information and more resources?
So I mentioned myasthenia.org, but I also want to mention Alexion Pharmaceuticals' helpful site, talkgmg.com, where you can really find tips about how to work with the physician and how to be a take-charge patient.
Very good. Thank you both so much for joining us. Of course, Nancy, for sharing your personal story, and Dr. Mozaffar for all the important information.
Thanks for having us.
Certainly. We'll be right back.